Chapter 3, the integumentary system, or your skin, and or your skin. The term integumento means to cover. So when we look at the body's first line of defense, it is our skin. So with chapter 3, we're going to be dividing it up into two different sections. The first section will be covering word roots and word parts, subjective terms and objective terms. So if you remember back in chapter 2, we learned about SOAP note format, subjective, objective, assessment, and plan. And so you'll notice the rest of your textbook kind of outlines that same format with the different body systems. So we start kind of from the outside in, looking at the skin. So let's begin with section 3.1, the parts of the integumentary system and their word parts. So that term integumento means to cover, and the word roots specifically that mean skin are cutano and dermo and dermato. So you're like, holy cow, why are there so many? Well, oftentimes, as you'll see when we cover the renal system and other systems, they do mean specific things. Okay, so cutano is oftentimes used when we look at the whole skin itself. Dermo and dermato is usually used for like their profession and the top of the skin. It just varies. And when you look at the entire structure of the skin, you see how it is divided into three main layers. You have the epidermis, epi meaning on top, dermo is the word root, which means skin. And it is this layer right here, okay, the layer that we see. You see, if you dive in, and we're not going to get too involved in the specific layers of the strata of the epidermis, but you see here how you have multiple layers upon layers of flat, dead, dried skin cells that are constantly sloughing off. And that is your epidermis. It starts out alive here in your basal cell layer, okay? And then as it slowly pushes up, it combines with the oil from the oil glands that we'll talk about here in a minute, and it dries out as it becomes further and further away or gets pushed further and further away from the blood supply and eventually dies. And that's the layer that you see in or on your skin, the epidermis. The next layer is the dermis. Okay, derma meaning skin. This is also known as the true layer of skin, or as they call the living layer. And that is because of the blood supply with it or to it. You see here how it has the capillaries, how it has the blood supply, and also how it has what's known as a lot of the accessory organs with the skin. This is where you'll have your hair follicles. This is where you have your sudoriferous glands, where you'll have your sebaceous glands, okay, your oil glands, and your sweat glands. We'll learn about those here in a second. And other your nerve endings. Okay, you see some of your corpuscles here and your different types of nerve endings that give you your sense of touch. Okay, allowing you to feel the softness of a kitty cat or the boom, boom, boom of the bass in your car, okay, the radio, or the soft vibrations of the vacuum cleaner when you're vacuuming, those kind of things, or pressure, okay, like when somebody's pinching you, ow, you feel that pressure. That is because, or thanks to, these different types of nerve endings that are found here in the dermis of your skin. And then lastly, you have what's known as the hypodermis or subcutaneous layer. So let's break that down. Hypo meaning below, dermo meaning skin. So you're below this dermal layer, below the true layer. Oftentimes, it's also called subcutaneous, sub meaning below. Cutano is that other term that can mean skin. Okay, remember here, cutano, dermo, or dermato. And us is simply the noun ending, means pertaining to. When we look at the cells that are found here within the hypodermis or subcutaneous level, that is where you will find also what's known as your fat cells. The medical terms or the root words for those are lipo, adipo, or steato. Okay, so there again, usually we use adipo when we're looking at adipose tissue as a whole many fat cells put together. Lipo is a lipocyte or a lipoma, a swelling of fat tissue. And then steatosis here, osis meaning abnormal condition. This is the abnormal condition of fat. It can be fat in an abnormal place. It can be fat escaping from the digestive system. Okay, is a certain type not to get too gross, but when people can't absorb fat in their GI tract, they excrete it out in the stool, and that's known as steatorrhea. That term steato meaning fat. The accessory organs here that are found within the dermal layer, your hair follicles, and we won't get into the details of the hair root, the hair nerve, the hair shaft, that kind of thing. Just know that the term hair, your word root for hair is pillow or tricho. Okay. And hydro is your sweat glands, also known as your sudoriferous glands. Sudorifero meaning sweat, okay? Or hydro it meaning water. Or excuse me, with an I, hydro with an I means sweat. Okay, so hyperhidrosis, let's break that down into its word parts. Hyper meaning excessive, hydro meaning sweat, osis meaning abnormal condition of. So this is a person who is excessively sweating. Hypohidrosis is the lack of sweat or low sweat. Okay, hypo meaning below normal. And then anhidrosis can be life-threatening. Anhidrosis is lack of sweating, okay, which is one of the warning signs of severe heat stroke. An is the prefix that means without or none. Hydro meaning sweat, osis, abnormal condition of. Within the integumentary system, you have the structure known as your nails, your fingernails and toenails. Their purpose is to protect the distal ends of your appendages, so your fingers and your toes. So the word root for nail, onkyo or yunguo. Onkyo or yunguo. So when you trim your nails, you're actually cutting the excessive nail that has grown from the nail bed. There are many more word roots related to the nail structure. But for this class, just onkyo and yunguo. Okay, so onculalgia here, algia meaning pain. So onkyo here meaning nail. So this is where you squished your finger in the door and you now have fingernail pain. Or subungual, this is below the nail. Three word parts here. Sub is the prefix. Unguo is the word root that means nail. All is the suffix that means pertaining to. Also within the dermis of the skin, you'll have your sebaceous glands. Those are right here. Hang on. Right here. Okay. This one right here, this is a sudoriferous gland or a sweat gland, okay, that excretes its sweat directly out onto the top of the epidermis. You see here oil glands or sebaceous glands, on the other hand, secrete the oil directly into the hair shaft, right? So two different areas there. And the combining forms for oil are sebo and sebaceous or sebaceous. Okay, we'll talk more about different types of oils in the body, but actually the oil here on your skin does aid as one of the main barriers and lines of defense for your skin. It actually slightly changes the pH of your skin to prevent, not prevent, but to deter or inhibit the growth of bacteria. When we look at changes to the skin or pathology, patho meaning disease, some things that, some other areas of the skin or some difficulties with the skin can be that it becomes too hard or too dry or too soft or change in color. So let's look at those real quick. Kerato means hard or horny, as in the horns of a rhinoceros that you see here, or the horns of a dinosaur. They are made of keratin, that term kerato there. So your nails, your nail bed, the components. Also, when the skin can become hardened due to multiple reasons, that can be a form of keratosis. Okay. When the skin becomes dry, that is known as xero here, xeroderma, which is dry skin. Okay. So xero here with an X. And then when we look at color, there's a medical term for pretty much every color. And the main ones associated here with the skin. So not only does it mean skin color, as in the melanocytes, which are, let me show you. We didn't even talk about that, did we? Your skin color comes from the melanocytes that are found here very close to the dermal layer of the epidermis, okay, one of the lower strata layers here of the epidermis. So those melanocytes, melano meaning dark or black, is what gives you your skin color. Some other things that can go wrong with the skin: when you have yellowing of the skin due to jaundice or other types of infections, crusts, pustules, those kind of things that can be on the skin. That is xantho, so xanthoderma, the yellowing of the skin. Urethro here means red, so urethroderma, that is the reddening of the skin. And there again, there's a whole lot of other diseases related to that. Leuco means white, or albo. Albo here means white. So leucoderma, whitening of the skin. So this is the lack of, or albinism, excuse me, is the lack of that melaninic pigment within that epidermal layer. Okay. And then here we talked about melano, meaning black. Okay. There's also one for green, one for purple, one for gray. We'll learn those as we go through the unit. Okay, and as always, please definitely do your learning exercises. So here you're simply matching them up. Okay, lipo meaning fat. Okay, dermo meaning skin, dermato meaning skin, hydro meaning sweat, adipo meaning fat. Okay, onco and unguo meaning nail. Okay, so make sure you're filling those in as you go along. Same thing here. What are these combining forms? Or, yeah, combining forms. Okay, tricho meaning hair, pillow meaning hair. And then lastly, break these terms down into their word parts. I wish there was a way I could do a couple of these for you online. I need to figure out how to do the writing feature on this thing, but dermato would be the combining form that means skin, and ology meaning study of. Lipoma, two word parts there, lipo meaning fat, oma meaning tumor or swelling, and so forth and so on. If there's any of those that you get stuck on, please let me know. Same thing here, simply defining these terms. In exercise 5 here, you're building the medical term. You'll be doing several of these, as you know, on your homework assignments. So make sure you're familiar with these. And spelling does count. Okay, so make sure you're practicing these as you go along. Inflammation of the fat tissue, steatitis, a nail disease, osteopathy, that kind of thing. Okay. And then lastly, what are the 3 word roots for skin, the word root that means black, so forth and so on. All right, moving on. The next part here, the subjective terms. So now that we understand the basis and some of the word roots related to the skin, let's now look at what can go wrong with the skin or injuries. So a person is going to seek medical care when something goes wrong with the skin. So let's look at some of those more common terms. An abrasion is the scraping away of a top of the epidermal layer. Albinism is what we talked about earlier, that lack of pigmentation. Alopecia is baldness. Okay. Anhidrosis. And remember, you can definitely take advantage here of playing of the terms, and I definitely recommend that. And also, if you haven't noticed, I don't know if I mentioned this in the first couple of videos, I think I did, but the terms here that are emphasized, if it's in capitalization, then that means it's emphasized. Okay, so anhidrosis, that dro, okay, dro, anhidrosis. So that's where you would put the emphasis when you are pronunciating the word. Dermatalgia, skin pain, and also you see how it's broken down here. Skin pain, dermatodynia, dermatalgia, erythema, erythroderma, hydropoiesis. Okay, never, ever, ever be afraid of medical terms. Break them down into their parts. Okay. Yes, it looks big and intimidating. Hyperpigmentation, hypermelanosis. Holy cow. Yikes. What does that mean? You know the prefix hyper means excessive. You know the suffix osis means abnormal condition. Okay. Break it down into its little teeny parts and you can uh, definitely get it. All right. Leukoderma, onchophagia. This one is kind of common. Phagio here means to eat. So this is nail biting. This is the abnormal condition of biting your nails. So if you're a nail biter, onchophagia. Okay. Pruritus, trichomegaly. This term megaly or megaly means enlargement. That might be a new one for this section. I'm not sure if we've had that one yet as a suffix. So make sure you kind of highlight that one. Okay. And then xanthoderma, yellowing of the skin, yellowing of the sclera of the eye. Okay. Then you have your learning outcomes for 3.2 here. There again, simply matching them up. Nasopharyngoscope. Okay, break it down into its word parts. Naso meaning nose, pharyngo meaning throat or pharynx. Scope is that term we had in chapter 1, which means instrument. Okay. So make sure you do your learning exercises here. Selecting all the terms that have white as a word root or as a meaning. Right? So there's only 2 here. What 2 would they be? Which 2 would they be? Number 6, select all terms below that have roots meaning weight. Well, we know it's not anhidrosis because hydro means sweat. We know it's not erythema because urethra means red. Hydro means sweat. Xantho means yellow. Zero means dry. So the two that mean white are leuco and albino. So if you circled B and E, you are correct. Okay. And then lastly, for this part one is observation and discovery. So some objective terms that they would use in the objective section of the medical term are how to describe what the medical profession is seeing. So, what is the size or color or texture or filling of the skin condition? All right. Is it a small bump? Is it a bruise? Is it a large pimple? Is it a large discolored macule? Is it a mole? What is it? Is it a burn? So we have very distinctive terms related to each one of these conditions. All right. Periorbital hematoma, peri meaning surrounding, prefix that means surround, orbit meaning the eye socket. Okay. And hematoma, hemo or hemato meaning blood, oma meaning swelling. So this is a black eye, okay, a periorbital hematoma. Some primary terms for specific lesions: a macule, also known as a freckle. Okay. Macule or a macula. Okay. Latin for spot or stain. Okay. Very beautiful. Yep. Freckles can be very pretty. Patches, large, flat, discolored areas. A papule is a small, solid mass. Okay, papule. There again, what's the cause of that papule? It can vary. We're worried mainly here with just describing what is being seen. A small, flat, or a small, solid mass. Can be flat, can be rounded. Plaque, as you see here, is a solid mass on the surface of the skin. A bulla is kind of like a large blister, so a sunburn blister, or when you get like a blood blister. A pustule, okay, think of your typical pimples and blackheads. Okay, these are your pustules. A pus-filled little blister. And a vesicle, a smaller type blister. So when you get into dermatology, or if you get into um, cosmetology or aesthetics or anything like that, you'll go deeper into the different terms and types of some of these skin conditions. Some more serious or secondary skin lesions, the ones that are can become very serious. You have ulcers. Okay, so you have these are sores that are. I need to rephrase. These up here are usually the epidermal layer. When you get down into these different scales and crusts and different types of vascular lesions, you're getting down into the dermal layer of the skin. Okay. A crust. This is, think of this scab. Okay. Kind of the scab. We've all had scabs that you've picked at before. This is the dried substance, the dried blood, pus, um, um, not plasma. Well, yeah, plasma, part of that healing process of how the skin regenerates itself or grows from the inside out. Okay, starting at that dermal layer, working its way up through the epidermal strata. Ecchymosis is the term for a large bruise. Yep, ecchymosis or ecchymoses. Okay, a bruise. And then petechia, petechiae, petechia. Yes. So these are small bruises, and I wish they had I need to show you a picture of these. This is more of an ecchymosis, okay, a large bruise. Petechiae or petechia, these are like small pinpricks, like if you took a purple pen and just dotted your skin with the tip of the purple pen. That is what petechiae is. They're again caused usually by high fevers or different types of injury to the body. Okay, you have different terms for scars. You have cicatrix in keloids here. So these are when the scar is formed and then the overgrowth or tumor swelling of a scar on the skin. And then you can have different types of what they call epidermal tumors. Okay. Yep. Also known as your moles. Okay. There again, some can be very beautiful, but you also want to look out for those and monitor them that they are not growing and can become different types of skin cancers. And then what can we do to the skin lesion? Okay, sometimes we need to remove it. So that is known as a biopsy. Okay, biopsy. Bi meaning two, ops meaning I, and then procedures, the removal of the skin in order, or the tumor, the macule, the nevus, whatever it may be, that we're wanting to get a better look at and look at it better. Okay, so you're looking at it under the microscope. You're looking at it with another set of eyes. This is the term two eyes. Right? Keratosis. This is the what we talked about earlier of these hard, kind of crusty growths, this horny tissue condition here on the skin. You see a very good example here. And then onchocryptosis. This is a fun one. Maybe you've had, I hope you haven't had these, but also known as an ingrown toenail. So let's break this down. Onchocryptosis. Onchio meaning nail, crypto meaning hidden, and osis meaning abnormal condition. Okay. Onychocryptosis or onchocryptosis. All right. And then, as usual, as always, do your learning outcomes. Do them over and over and over and over and over again. And when you do your learning exercises, as you know, you'll do them again and again. Repetition is the best way you're going to master this class. So repetition, repetition, repetition. All right. So let me know if you have any questions. We will pause there for unit or for chapter 3, and we will do assessment and plan in our part 2 video for chapter 3, the integumentary system.